Hello and welcome, everyone. My name is Jessica Quick. I'm from the Peel Newcomer Strategy Group. We're the Peel Local Immigration Partnership in Ontario. And I have my colleague here, Shreya Seksaria, and she'll be introduced shortly for her presentation. And Kanalpreet Kaur from Punjabi Community Health Services in Ontario, and also Melanie Bailey from Immigrant and Refugee Services Association in PEI. So we're really delighted to come together since I've had the pleasure of connecting with each of these individuals in different ways in our individual LIP work, but also how we can really leverage each other's strengths to really move forward in our own environments and geographies. So it's really exciting to also have you all join, and hopefully there's some opportunities to have a discussion at the end. So we're going to have each of the presenters share their slides, and then we'll have some time at the end for discussion, but feel free to use the chat box if you have any questions. I'm going to start with the land acknowledgement. So for us, we are coming from Peel Region, which consists of the municipalities of Brampton, Caledon, and Mississauga. And it's the part of the treaty lands and territory of the Mississaugas of the Credit First Nation. And so there's generations and generations of Indigenous communities who have cared for this land, including the Anishinaabe, Huron-Wendat, Haudenosaunee, Ojibwe, Chippewa, Métis, and others. So we continue to recognize the contributions of Indigenous communities today. And just also want to share a little insight. We had Reverend Peter Jones as part of the Mississaugas of the Credit, who really acted as a cultural broker, as he was part Ojibwe and part Welsh, and helped the Indigenous community continue to function and have some land around the Credit River be maintained for as long as possible before they had to move due to policies. And so this Credit River really represents a lot of connection between the municipalities and with the Indigenous community as well. So just as a light moment, I thought we could use a slothometer and please feel free to test out the chat box and to note the number that indicates a sloth that reflects how you are feeling. So there's some more dainty looking ones and more ferocious looking ones. So depending on your feeling, how you're feeling, feel free to use the chat box, and we can test out that it works for everyone. So I think because I'm a presenter, I'm trying to look cheery. Great. Oh, okay, we don't have access to the chat. So anyway, you can reflect to yourself on which sloth best represents how you're feeling. A good check-in for self. Okay, I'm going to move to introduce Shreya Seksaria. So Shreya is our service integration specialist at the Peel Local Immigration Partnership. And she has work experience with CMHA Toronto as well as a health equity specialist there as well. So before I turn it over to her, I'll just also note that she also supports a lot of sector capacity building through organizing professional development, and mental health often comes up as a key priority. And so she's enjoyed working with the LIP for about 2 years and really feels that it gives back to the community. So I'll turn it to you, Shreya, to share your slides.
Thanks, Jessica. I'll just start sharing my slides now. Right. Thanks, everyone, for joining us today for this presentation. So today I will be talking about a recent project that we have been funded. So we have started really recently. So it was in November that the funding came in. And the project focuses on newcomer youth mental health, and it also explores the opportunity of bridging the sectors for improved support for mental health for newcomer youth in the Peel region. So before I dive into details of the project, I would like to share something about the Peel region. So as Jessica mentioned before, Peel region comprises of 3 municipalities, that is Brampton, Mississauga, and Caledon. And talking about the demographics and the mental health services in Peel region, so about 51.8% of Peel's population are identified as self-identified them as immigrant population, and they mostly come from Asian background. So 64% of the immigrants come from Asia, and therefore we have the top 5 languages that are mostly Asian. That is Punjabi, Urdu, Hindi, Arabic, and Gujarati. That is spoken widely in Peel homes. And also, one interesting factor is that 69% of people in Peel identify with rationalized communities, and that is one of the highest in the Greater Toronto area. Talking about the mental health needs in Peel region, mental health and addiction services continue to be a high need priority for residents in Peel, and it is estimated that only 1 in 3 residents will receive the treatment that they need. The unmet demands has resulted in long wait times and increased hospital emergency and increased visits to the hospital emergency departments. And some statistics mention that in 2019, 28,000 youth under the age of 18 in Ontario were waiting for community mental health services, which is more than double of the estimate that was 12,000 in 2017, and Peel had highest long wait list for child and mental health services, which was 737 days. And recently, I was attending some sessions in the morning, which also mentioned that in some of the other provinces too, the wait list for availing the community health services on mental health is about 2 years. Moving on to the next slide. So talking about PNSG's mental health work. Mental health is one of the strategic priorities for us for the years 2022 to 2025. And in June 2023, we released a report that focused on mental health, and it was titled Newcomer Mental Health and Wellbeing through a Settlement Sector Lens. The report is also available on our website. So the purpose of the report was mainly to outline the role of immigrant and refugee serving settlement sector in supporting the mental health of newcomers, particularly in situations of crisis and trauma, to identify key issues related to settlement service delivery and mental health needs of newcomers, to highlight cross-sector initiatives in mental health services, and also to recommend strategies to improve access to mental health supports. So the report brought about 7 recommendations, but our present project focuses on 2 recommendations that includes increasing collaboration between Ontario health teams, mental health services providers, and settlement providers to create culturally appropriate programs and services, and also to explore a family-centered approach to mental health care for newcomers, and especially the newcomer children, youth, and seniors. How did we get started and came about bringing about this proposal? So there was a lot of work done in the background, and to find these bridges to improve the mental health services for newcomer youth in Peel region. As I shared, we came about with this report in June 2023, and in the starting of 2023, we shared a draft with our stakeholders and working partners. So, and we had this virtual forum in February to find bridges to improve the to find those bridges between the different sectors in the Peel region who come together in the journey of settlement of newcomers. So this was a virtual session that was held, and we had about 100 participants in that. Mostly frontline workers and managers of settlement agencies and mental health service providers. And after that, we also came together in person, inviting the senior leaders from settlement sector and mental health providers to explore the opportunities to have more culturally appropriate mental health services in Peel region. And lastly, we were able to bring these recommendations into action through this project that we got funded in November. which I'll be walking over in the next few slides. So this project is funded by Region of Peel's Community Safety and Wellbeing Plan. This initiative provides a roadmap on how partners can work collaboratively across different sectors towards a shared commitment to make Peel a safer and a more inclusive and connected community where all residents can thrive. While the plan recognizes many issues that impacts community safety and well-being, there are three focus areas that includes family violence, systemic discrimination, and mental health and addictions. And our project is funded under the mental health and addictions table. So this mental health and addictions tables include organizations that provide mental health support, community agencies, youth serving agencies, and police. So talking about the working partners in this group, so we have a planning committee which has representatives from different sectors, which includes school board, post-secondary institutes, obviously settlement agencies and Peel, child and youth mental health providers, and also healthcare. So the project goals includes increasing provider connections to newcomer youth perspectives and connections among different sectors. And that's why we have included 5 other partners from different sectors. Peer learning opportunities for youth participating in photo voice process and community advisory board. Improve culturally responsive services for newcomer youth and international students needing mental health supports, and more accessible family-centered communication avenues to learn about mental health wellness and care pathways through multilingual videos. This slide gives an overview of the project, which will be ending in December 2024. So the blocks here shows the different activities that would be carried out throughout the project cycle. We recently got the fundings, and we have this cross-sector collaborative forum that we are planning next, that will be held next week. So we are expecting about 180 participants from different sectors that includes mental health services, healthcare providers, school boards, post-secondary institutions. And this forum would be an opportunity for all the sectors to come together and have that conversation on how we can work with the existing resources and build those connections to provide and improve those services for mental health, for providing mental health supports to the newcomer youth and also international students. We are also in the process of recruiting a community advisory board, which will include 2 groups. That would be newcomer youth and international students, as the needs of international students and newcomer youth will be different, are different, as international students are not supported by their family, they are alone, and there are different needs. So 2 advisory boards would be formed. Following to which the community advisory board would guide us on or throughout the project cycle on what would be those culturally appropriate services that needs to be included in the services that is offered by different stakeholders. After that, in March and May, we'll be developing the trainings for all settlement providers and service providers, following which training would be implemented throughout September. And and also I missed out, sorry, on the photo voice. Photo voice is another way of expressing feelings, and the photo voice project will involve again newcomer youths and international students, and the photo voice insights will give us again a guiding will be our guiding principles on developing those trainings for the settlement providers. And we will be also developing some video series on stigma reduction for newcomer families. So having that family-centered approach to providing those services and including families also in providing those mental health support to the newcomer youth. And finally, all the inputs and recommendations that comes through our planning committees, through the forum, community advisory board, We'll be also proposing to have those wellness spaces for newcomer youth, which will be safe spaces for newcomer youth to share their experiences, and also to provide those a therapeutic alliance between the service provider and the service users, where service users are the ones who who formulates their pathway of getting those services. So giving that ownership to the service users, and having that multi-sectoral approach during this project is the whole focus of this project. So yeah, that's all from me. Yeah, and I'll pass it over to Jessica.
Thank you so much, Shreya. And just to share that, bringing the sectors together will help hopefully in the future to facilitate some of those warm transfers, as people might use, for example, short-term counselors in some of the settlement agencies to more longer-term services as needed. Sometimes that rapport between staff is so important. So that's great to hear that those sectors are coming together. And also, just developing a community of practice as we start to serve and orient our services more towards newcomers in general, but newcomer young adults and international students. There's probably training that can be done across sectors. And so I'm really excited to see how that all unfolds. I'm going to introduce Kanwalpreet Kaur from Punjabi Community Health Services, and she's going to be speaking to a building capacity program that she's been working on for the past while, and has been working in collaboration with more than just Peel region, other regions as well, through various trainings that use a train the trainer model. So I'm going to turn it to Kanwalpreet. So thanks so much, Kanwalpreet.
Thank you so much for the warm welcome, Jessica, and thank you all for being with us here today. I will just take a moment to share my screen. And I believe you can see the full screen mode of the screen. Great. So today we will be talking about capacity building through the mental health lens, and I will keep going through the slides. Just give me a moment. In particular, we will be talking about newcomer-serving staff trained on mental health fundamentals. And before we move on, just a brief agenda as to what we would be discussing, a little bit background regarding capacity building, the need for the program, the process in which the program is undertaken, and the delivery of the components of the program, and finally ending it with the summary. So the background is that the social determinants in the post-migration context are consistently identified as the most important factors affecting mental health of immigrants and refugees. And as Shreya spoke about the mental health needs of newcomer immigrants and how they are not really met specifically in the Peel region, and also to talk about the fact that Peel has the highest proportion of immigrants in Ontario. So since this program started in the Peel region, it is important to acknowledge the fact that there is a widespread need for this program. So as a service provider, it's important to acknowledge the impacts of social determinants, to inquire about such factors as housing, income, and other socioeconomic status or experiences of racism and discrimination. Newcomers not only face mental health concerns here, but they have histories before coming to Canada, and their migration journeys to Canada and their post-migration integration experiences are hard and may influence mental health problems and illnesses for some immigrants and refugees more than others. Therefore, it is, the frontline workers' role is almost critical in promoting clients' mental health and well-being. So frontline workers, as we all know, are mostly the first point of contact for information, orientation, referral assistance during the post-migration process. And it is absolutely crucial for frontline staff to create a space which is safe, where needs can be identified and frontline workers can refer clients to required services like counseling, mental health support, legal assistance, etc. through these services. So these services help address various social determinants which may impact client mental health. And the connection to these very services may help promote resilience and a sense of belonging. Thus, frontline workers' role is really very important and integral to the promotion of immigrant mental health. The need for the capacity building program is based on these factors, and there could definitely be more. Frontline workers need tools, resources, and skills for assisting newcomers to provide trauma-informed and culturally competent services while working with newcomers. Also to equip frontline staff to work on their self-care and wellness because they're constantly listening and absorbing. And also to raise awareness concerning frontline workers and newcomers' mental health and well-being. The program or the need also focuses to provide culturally competent, trauma-sensitive, and mental health first aid services to newcomers. Before I talk about the Peace on Punjabi Community Health Services and how this capacity building program came into being, it is also really interesting to see that the same time as the capacity building program came into existence, we were hit with COVID. So it coincided with that and the need arose more than ever. Talking about Punjabi Community Health Services, PCHS, it was established in 1990 by Baldev Matta, now former CEO, upon his graduation as a social service worker. PCHS is a culturally and linguistically competent settlement service provider to newcomers at no cost. Settlement services at PCHS are offered in more than 12 languages, and we take a lot of pride in that. And PCHS is also one of the rare service providers that offers services in mental health and settlement. And on the right-hand side, we can see the different programs that are offered at PCHS, including mental health, addictions, geriatrics, better families, and community development, to name a few. Sometimes we always wonder why PCHS for the capacity building program. So PCHS officially initiated, like I mentioned, the capacity building program in 2020, funded by IRCC, but it had been facilitating trainings already to frontline workers way before that for many, many years. So it only made sense that it became official and we, had a structured program that had different components and it could be delivered accordingly. The program runs across 9 regions in Southern Ontario, and the program also runs in collaboration with local immigration partnerships across all regions, like Jessica mentioned. So LIPs are highly integral to the delivery of this program for multiple reasons. As we can see, they serve as a channel of communication. They help with networking amongst frontline staff. They help in the promotion of this capacity building program, and also in creation of opportunities for professional development from time to time. Now, the delivery of these components, first I'll talk about the regions. So some of the regions in which the capacity building program is being delivered are Simcoe, Kingston, Peterborough, Brantford, Hamilton, York, Durham, Halton, and Peel. In the region of Peel and Halton, PCHS collaborates and works closely with Peel Newcomer Strategy Group to promote and deliver trainings. And PNSG has been instrumental in the flow of program information to various agencies across Peel and Halton. PNSG and PCHS collaborate from time to time, and very often, I would say, on activities and events related to mental health and well-being for the frontline staff. And this program and the delivery would not have been possible without the continuous support from the LIPs. Talking about the capacity building program as such, so the capacity building program has 4 components: trauma-informed approach, cultural competency, compassion fatigue, and mental health first aid. The reason why I've segregated these programs is because the first 2 components, trauma-informed approach and cultural competency, are offered through the direct training model, and the compassion fatigue and mental health first aid are offered through train the trainer model that Jessica spoke about earlier. And just to talk briefly about what these mean to anyone who is not really familiar with these terms. So the direct trainings are delivered by the trainer to a group of frontline staff who can then implement the tools and resources shared in their service delivery. However, the train-the-trainer model is a method in which a selected few staff are trained in every batch of the training and then become certified facilitators who go on to train the other frontline staff in their region. The trained staff delivers trainings across their own regions to eventually create a network of trainers and create a pool and tool of resources for one another. And this has been really instrumental in spreading the word and creating a network in sort of streamlining services, because we rely heavily on this pool of trainers. The benefits of attending these trainings are as follows. The trainings are offered absolutely free of cost to the trainers, and through IRCC PCHS funds these trainings. While attending the trainings, these help frontline staff to navigate the challenges newcomers face in a more informed and competent manner. The trainer trainings come with the certificate to the facilitators from the Mental Health Commission of Canada and TEND Academy. Trainers can help train other frontline staff and promote wellness, self-care, and other professional development in their regions. And trainers can participate and represent their organizations at various professional development events. Just to briefly talk about the components of capacity building programs. So trauma-informed care, this training mainly focuses on concrete strategies to guide professional work of service providers, assisting clients with mental health and substance use concerns. Also to have a better understanding regarding the guiding principles for incorporating a very trauma-informed approach, whereby letting the frontline staff know that they have to assume that every client is coming from a place of trauma. And these trainings have helped the frontline staff immensely in acknowledging the pain and hurt of the clients who are coming from places of war, who are coming from places of trauma, domestic abuse, or any other kinds of trauma. And also to have awareness regarding steps for creating safer work settings for both the service provider and the user, and to have an action plan for trauma-informed goals in service delivery and program planning. These trainings also help the frontline staff become more aware regarding not re-traumatizing clients by talking about the same thing. So the principles are discussed in a lot of details with the frontline staff, with case studies and examples, and there is room at the end for questions. The next component is mental health first aid, and MHFE focuses on the 4 most common mental health disorders, including substance-related, mood-related, anxiety and trauma-related, and psychotic disorders. This training has been instrumental for the frontline staff in meeting client needs and catering to diverse client needs as well. And this training is delivered in collaboration with the Mental Health Commission of Canada, and it's delivered through the train-the-trainer model. So the trainers are first trained through the commission, and once the trainers are trained, they then go and train the other frontline staff. So that is how we've been creating a network of trainers where more than 90 frontline staff have been trained in the mental health first aid already. Participants who take this course are well prepared to interact confidently about mental health with their family, friends, communities, and workplaces. So this is not only confined to the frontline staff and clients alone. Mental health first aid and the principles learned could be applied to friends, family, and anyone who shows symptoms of decline in mental health. And frontline staff preparing to be MHFA facilitator are offered the course so that they're better prepared to help clients by offering the best course of action. The next one is compassion fatigue. As we are in a profession that constantly requires us as frontline workers to talk to clients and offer them the best services possible, sometimes we become those sponges or cushions that absorb a lot, and in the process we don't realize how worn out we are with empathy fatigue or compassion fatigue. So this program specifically catered to the needs of the frontline workers in creating a training around their own well-being and mental health. So this training specifically created awareness around both physical and emotional fatigue, resulting not just from chronic use of empathy, but also chronic exposure to seemingly hopeless situations that frontline staff often talk about. They often talk about the fact that we've had endless clients today who came from war or other kinds of trauma, and that doesn't seem to end for the past couple of months, and we're all in the same boat as of now. So for frontline workers who are dealing with that, it's really important that they indulge in self-care, mindfulness, and they take care of themselves as well. So this training helped them to identify the risk factors for secondary traumatic stress and empathic strain. It also helped them to develop strategies to take stock, reduce trauma exposure, and reset. And finally, it helped them make a plan for sustainable change by talking about the risk and protective factors, including creating an environment of empowerment, of encouragement, of sharing, so that workload could be distributed accordingly, so that they don't feel worn out, they don't feel fatigued. And lastly, the fourth component talks about cultural competency. This training provides participants the opportunity to grow their knowledge, enhance their knowledge of working from an inclusive and culturally competent framework in an effort to be a better service provider to the clients they serve. And also PCHS, from the very beginning, has developed its own holistic service delivery model based on the core principles of family-centered approach and cultural competence, as opposed to an individual approach, where families are treated as units, and if the individual requests, families are brought into the counseling sessions so that a better holistic service delivery could be provided. This is one continuum of cultural competency that is usually shared in most of our trainings, and it's a beautiful it's a beautiful elaboration of how we still need to learn a lot. And so whenever this chart comes up, the trainer always asks the audience, where exactly do you think you are on this continuum? And it gives them a moment to reflect and think about where they are, because certainly we are yet to work towards cultural competence, and cultural proficiency is, I would say, still a dream. So these stages help us to become more aware and be more mindful of being a better service provider, keeping in mind the cultural competence aspect of service delivery. And to summarize, I would just like to share that the capacity building program is running successfully across all 9 regions, with trainings being organized from time to time. And as a matter of fact, we are currently open for the mental health first aid facilitator training, and we are recruiting participants, frontline staff specifically, across all 9 regions. So if you do know somebody who would be interested, I will be sharing my contact information at the end. Please feel free to get in touch with me. Trainers and frontline staff have shared immensely positive feedback after participating in these trainings, and there's always request for more, as I share with Shreya and Jessica from time to time. PCHS's collaboration with various LIPs on this program has helped create a network of trainers across these regions, which in turn has helped newcomers in more ways than one. And I would like to thank you all for being such patient listeners. And before I go, I would just like to share my contact information and my email address. So if you have any questions, you can get in touch with me anytime. Thank you so much, everyone. And over to you, Jessica.
Great. Maybe Kanwalpreet, it's such a wonderful example of working across different regions and really leveraging the work in the different communities across Southwestern Ontario. Just wondered, from your perspective, is there connections that people have made across the trainings across regions, so that there might be like a community of practice already kind of coming together naturally, just on the basis of the trainers going through some similar, training?
Yes, yes, Jessica. We have actually, like for MHFA specifically, the train the trainer model. We have co-facilitators facilitating the same training and from different regions. So they continuously get in touch with one another. And Mental Health Commission offers a great networking platform on their website as well, where you can connect with other facilitators as well who might be in a different region in the country altogether. So yes, they have been getting in touch. They are, networking even beyond their own regions.
Oh, fantastic. Thanks so much. I'm going to now turn to Melanie, who joins us from PEI, where most of us are local immigration partnerships. Melanie is the project manager of the Provincial Immigration Partnership for PEI through Immigration and Refugee Services Association. She's also the Vice Chair of Pathway to Prosperity's Standing Committee on Immigration to Northern, Rural, and Remote Communities. And through her Provincial Immigration Partnership, I don't know if you use the word PIP, as we use with LIP. Okay, perfect. Since 2015, she supports PEI's settlement sector and has developed PEI's province-wide 1,000+ partnership network through outreach, consultations, working groups, info sessions, and collaboration forums. And her team supports this network through research and trend analysis, information sharing, and facilitating collaboration. And I've been so glad to hear Melanie. We actually had her speak at our February forum of how she really launched into PEI with different mental health initiatives. So I think it's such a treat that she's here to share again. Thanks so much.
Thank you, Jessica. What an honor and what kind words. It really is an honor to contribute to this conversation today. It is an important discussion, and I am here with experts, and I have been fortunate to tag along. The work that's been done in Peel Halton has informed our work in PEI, and we can't be more thankful for the work you've done. That's helped us greatly. And I would love to sign up and join those train the trainer programs. What wonderful presentations and opportunities you're offering there. I took a few notes. While many of us LIPs aren't direct service providers, the local immigration partnership programs were really uniquely positioned to see the bigger picture, to see gaps and opportunities in the settlement sector. In PEI, following surveys and research in 2020 to 2021, the work of supporting our partners in expanding mental health support became one of the two most urgent priorities in our action plan. I'm going to walk you through our process now. And basically, there's three sections. First, we'll start with the background. Two, I'll move into taking action. And three, brief discussion around why this is still such an urgent priority. The background, it began in 2020. We were living through a time like no other. The world closed, locked down, and many of our immigrants were locked into a still unfamiliar land, separated from family and friends, suddenly loss of jobs, didn't know if they could pay their mortgage, had no one to turn to, limited social networks. Their children weren't doing well without the social connections of schools, and all of that stress turned inward into family units, and struggles with maintaining healthy relationships surged to levels that hadn't been seen before. In the backdrop of all of this happening were survey comments. From June 2020 to August 2020, the comments became more urgent. Crisis statements showed up in our survey. And I have to thank one of our partners especially, but a few of our partners that saw that and helped us prioritize it, helped get behind it, helped pave the way, and helped us find funding. Following that, we urgently did environmental scans to understand what was going on. Obviously, we know it was a time like no other, and that mental health was impacted, but it was happening in the moment, and there wasn't a lot of data and insight to tell us what was happening and how we could respond. In the environmental scan, basically, it gave us a baseline. We knew that mental health had surged in the Canadian population, with mental health before the pandemic being reported at 8% and then surging up to 24% following the pandemic. Statistics Canada advised that not only was Canadian mental health impacted and worsened, the immigrant mental health had worsened even more. And this is in direct contrast to the healthy immigrant effect. And so sometimes it is important for us to talk about. I do feel when an immigrant first arrives, it's new, it's exciting, and the mental health may improve. But when the challenges of immigration settle in, often there are well-being risk factors and challenges that our immigrant community faces and really needs our support with and walking alongside them through that journey. Fast forward 2 years, 3 years, now we're into 2023. Again, we're living through a time like no other. Across Canada, we're facing healthcare access barriers. There's this struggle in maintaining jobs and the pay of jobs and cost of living, inflation, cost of groceries, paying mortgage or rent, finding a home. You know, it's a story that's playing out across Canada. It's impacting Canadians and immigrants alike, but it is also contributing to a continued increase and heightened well-being risk factors and well-being challenges. And of course, the consistent well-being challenge across our immigrant community has always been culture shock. So knowing the needs, knowing the urgency, knowing we needed to take action, where did we start? First, defining the challenge. Newcomers faced a decline in their well-being because of the pandemic in a new environment far from home. Accelerating challenges and trends following COVID have continued to contribute to well-being challenges. There is limited knowledge of symptoms, who to ask for help, a lot of shame and stigma, and no known first language support. The recommended action I'll speak to in the slides to follow. First, the most helpful guide that oriented us, guided us, gave us answers to every question and concern any partner raised, and really gave us a direction for moving forward. And once we were on that path moving forward, we were then able to reach out into immigrant communities, reach out to mental health practitioners, and then and help fill in the pieces to guide our work. Peel Halton developed documents that are helpful for anyone in Canada looking to expand mental health services or even start mental health services. There were 2 documents in particular that were helpful for us. And broken out by key topics. The key topics were the concerns and questions that partners had that we had to work through, whether it's professional standards and liability, the can and can't do within mental health services within settlement associations, and then how mental health works within the settlement team and parameters around professional standards, as well the other document around embedding mental health support in settlement associations, mapping mental health, qualifications, job roles, boundaries, challenges, ways to overcome those. The second most influential support in our work was Hong Fook Mental Health Association. They are based in Ontario. They have been providing mental health services to immigrant communities for decades. Their work with us, consultations, they graciously came and delivered an information session to our partners, and they guided us and they answered many questions, as did Peel Halton. They each of them went along with us on this journey. The encouraging part from their survey results, and just one slide, I'm moving forward from a much longer presentation and information they shared, is that the top 3 services that immigrants were seeking are services that we can provide within settlement associations. The other services obviously are outside of the settlement association. They are within the healthcare system, and they are much more expanded mental health programming that we can't deliver within settlement associations. The top 3 is counseling, the one-on-one support. 2 was educational workshops. 3 is information about mental health problems, treatment, or available services. Something we found and learned more in speaking with immigrant advisors is in many countries, they're decades behind in mental health acceptance. There's stigmas, there's shame, there's no words for it. So information and educational workshops are needed. From that, we pieced together an action plan to help guide our partners in developing and in expanding immigrant services, mental health services, with 4 key pillars being expanding one-on-one counseling support, 2 is self-assessment tools and trying to find an option around interpreters, which continues to be a challenge for a number of reasons. Well-being promotion and education, was much needed. And also we had to look at our helpline. We ran into difficulties where the existing helpline was only offered in 2 languages, couldn't be multilingual. And there were a number of barriers that were going to prevent our immigrant community from reaching help when they urgently needed help. Fortunately, the province of PEI had been working on and was able to move into this mobile mental health, which has been extremely helpful and has provided a service that any immigrant can use of any language. In developing culturally informed well-being services, one of the next most helpful pieces was a series of consultations and a focus group with immigrant health professionals themselves from our predominant cultural groups. So in PEI, our predominant cultural groups are Mandarin-speaking, Chinese, Vietnamese, various Indian languages, but large Indian community, Filipino community, as well as multiple Spanish-speaking communities. Those were the communities that we were able to get some progress with in speaking to and understanding what mental health support looked like to them and what mental health support should be provided to their cultural communities, as well as a few other cultures mixed in. Most revealing of all is, to me, it's almost a pre-counselor. It's someone providing a very caring, compassionate, understanding approach that helps them get comfortable with speaking about mental health and finding words for it. A lot of focus was around not speaking about mental health or illness, scrapping all wording, focusing on well-being, focusing on words and familiarizing it and normalizing it, and really reaching into the communities to help them reach back out when they need help. Some of the good news is around not only did our mental health services expand with our partners in the Settlement Association, it also expanded with other partners, and a lot of programming was introduced within these within these organizations. And so one of the priorities is around offering practical support and then introducing well-being support within that. So stress management is very popular in our immigrant community. So talking about stress management and then introducing well-being concepts. Women's circles, men's circles, youth circles, parenting is popular. So it's taking the needs, very practical needs, and intertwining that with well-being education. And oftentimes what those doing the work find is that they will do these sessions to large groups, and there's always 3 to 4 people that may step forward and say, I need help. And so that's the approach that's worked for them. And not to be remiss, this is still a priority. I look to the work, I see the needs that are out there still, and I hear the work that these experts on the call have done. And I think how much more we need to do, and how much more in the next CFP we have to do. This is still fairly new. Not all settlement associations have mental health services. It was a new concept for many, especially an expanded mental health concept. And I did see it picked up in the CFP notes, and I hope and I assume it may have turned up as a priority in the CFP as well. So this is encouraging. We all have a chance to really step forward in doing this work. Mental health trends currently have not abated. We thought the pandemic would go away, we'd get back to normal, but the data continues to show escalating mental health trends and concerning mental health trends. Most concerning of all, and something I've really struggled to get data around, and the best I could do was the kids helpline. The youth, general youth, all youth across Canada, they seem to fare a bit better at the beginning of COVID, but as it progressed, it worsened. Very concerning things like suicidal thoughts doubled, peer and partner relationships doubled, changes to families and relationships doubled plus a bit. Very concerning indicators. And so the question is, how do we reach the most vulnerable of the vulnerable, our youth? And how are our immigrant youth doing? Because it is very hard to get specific immigrant youth data. Unfortunately, we have a strong partnership now with our Chief Public Health Office. They are doing a survey that's actually done in many provinces in Canada. And they've introduced now, following our discussions, questions around born outside of Canada, born within Canada, and we're working on some discrimination questions So we hope in the future there might be some more data to show the difference between Canadian youth and immigrant youth, to see any patterns, needs, ways we can support. In our own efforts in this 2023 survey, we did do a focus in on the youth, in concern for the youth. And while we don't have the data, the settlement associations had the calls. And so in early 2022, the calls around suicide risk started to come into offices. So this is something that's on a lot of our minds, and wanting to understand it better. And in understanding it better, we'll know, the experts will know how to respond, and we'll be able to get behind the experts to help move them forward. So the best we could do in the survey was to do a couple of questions to check on our immigrant youth. And this data is parents reporting on youth, so it is not going to be as accurate as youth reporting their own experiences. But as you can see, immigrant youth well-being is significant. And it's even more significant in that kindergarten to grade 3 range, which was a finding I didn't expect, but it's something that showed up in the survey. As soon as the survey launched, that data point stayed high, elevated, and it continued to stay elevated. And just a reminder, in our immigrant community and in our Canadian community, again, this is a time like no other. Many people are struggling with, and our immigrant community is struggling with, often in an even more elevated way, with accessing housing, housing and cost of living, healthcare access, job insecurities, transits, mental health, immigration processing delays, their youth not doing well, work permit barriers, where most people come as work permit and can access a lot of services, cost of groceries, financial difficulties, childcare, their struggles with making viable businesses that can actually financially support their families. So that's data from our recent immigrant survey, and it just kind of is a lay of the land of the challenges. And essentially all of this, especially when it's compounded and there's multiple challenges at once, are all mental health risk factors for our immigrant community. Like was said previously, when an immigrant arrives within various associations, assume they're coming from a place of trauma, assume they're coming from a place of difficulty, and work from there. And so just that piece, that hope, the resiliency, the work across Canada around building resiliency, the better tomorrow, that comment, it's always better the next morning, that encouragement that it will get better. And a reminder that struggles and challenges do help us build resiliency, and they do build incredible strength. And it's part of the reason I believe, while the immigration journey is difficult, the incredible strength that comes out of it, including in the second and I think the third generation, but the research shows the second generation, the incredible abilities and strength that come out of it is a reminder that while the struggles are difficult, they do build incredible strength. And that hope, we have a wonderful, vibrant, strong, caring immigrant community in Prince Edward Island, many of whom helped inform this research. As well, we have strong and committed partners and leaders all across PEI who show up and are committed to making a difference. All of this work was made possible because of them. There's a special acknowledgement for some key people, including Jessica and Rodell, that were very early advisors in helping give us direction, and basically giving us direction by informing us on all the work that was happening in Peel Halton with the experts through their incredible documentation, as well as Hong Fook and others that got in behind us and supported us and made this work possible. So with that, I'll close our part in PEI around developing culturally informed well-being support in support of PEI's immigrant community. And I'll turn it back to Jessica. Thank you.
Thanks so much, Melanie. I really admire the depth that you put into your research, and always connecting back to the communities you serve. And really great to hear also the progress that's been made in connecting with your Chief Public Health Officer, for example. And so maybe, Melanie, a question is, are there key partners in your community who have helped you advance in some of those key pillars of activities that you might recommend for other communities who are looking to support around mental health?
Well, it's a really good question, because you're right. You can have all of the research and all of the best intent, but who's going to make it happen? So in Prince Edward Island, it is our Immigrant-Serving Association, IRSA. I am fortunate to be based out of there. I do work on other priorities that, and that would involve working with other partners. So I can't thank my organization enough because they are the ones that implemented it and are doing the work. We do have that wonderful partnership, early stages with the Chief Public Health Office, the province of PEI. You know, one of our partners, while they are a funder, they also really came in behind us when they saw the data and encouraged us to move forward. And also the immigrants themselves. There's a lot of immigrant doctors, nurses, and others in PEI in Canada, some practicing, many not practicing, unfortunately. But all of them, we reached out and they really helped guide us and inform the work. Yeah, thanks.
Fantastic. So I think the thread through all of these presentations really is that collaboration that really supports the work in this area, especially since there's so many dimensions to it, whether it's social determinants and thinking about some of those precursors to mental health, or if it's that system navigation to longer term services that may be needed. I'm going to just remind people, if you have any questions, please use the Q&A box at the bottom of your screen, and you can type in your questions there. We can also share a little bit of what we've seen at the in-person conference. There was a panel this morning focused on mental health. So some of the themes came up there too, and just thinking about some of the pieces that were raised, including the important time period of youth and young adults, and that it's sort of surprising to hear from Melanie in terms of how early some of those stressors can be seen by parents, but that those early years can be a time of intervention, if you will, or action, and collaboratively with young adults themselves and children. So I guess maybe I'll open it up. Melanie, if you want to start in terms of thinking about that youth stage, and I know the data pointed in that direction, but are there any, I guess, suggestions or recommendations that you have in terms of focusing in on that population group?
Yeah, that's something I thought about a lot. I know a lot of provinces have Swiss workers. It's not something we've been able to introduce into our schools in PEI, not for want. We'd love to be there. It just hasn't worked. But that continues. That's one way we can get more support into schools. And again, children spend most of their day in schools, so that's where the needs are going to present. That's where you can help them most impactfully. Also, there's external groups that will go into schools to provide services. So next week, we're in a meeting with them to talk about how we can support their work. The Chief Public Health Office, I didn't even realize how much data they have and how much willingness to collaborate. So that's an option as well. And I don't know. And then I'm also thinking of, and then the data, of course, but that continues to be an uphill battle, trying to find the data to really point to some of the trends. But I keep thinking about this, Kanwalpreet, you had spoken about this train the trainer. And I was thinking, we have a lot to learn still. And I wondered if you're offering that to others outside of your region, and if maybe some of us on the call and myself in our area might be able to join a session like that.
Thank you for that great suggestion, Melanie. I was just talking to Faisal, our manager at Settlement Services earlier, and I was just, you have the nerves before any presentation, and I was talking to him regarding the fact that are we, in the plans of expanding this, to other regions as well. So it all depends on the funding, right, so to speak, because that is how we have the funding for the training. But we would love to expand it beyond these 9 regions. Why not? I mean, there is a whole network of trainers operating in these 9 regions and working with the frontline staff and newcomers to provide these services. But Melanie, I'd be more than happy to, share more information with you, like after this presentation as well. And I would be most happy to offer any kind of help and support in my capacity.
Right, and Kanwalpreet, there is a list of trainers through the Mental Health Commission of Canada. Can everyone access that list to see if there might be a trainer in their area?
Yes, so the information is open on the Mental Health Commission's website. You can access the website and see the upcoming trainings. It's open to all. The sessions are there. And yes, you can definitely inquire about that. So every session is by month. So the upcoming training sessions would be posted there already on the Commission's website.
Perfect. That's great. And Shreya, I know that you have some experience in health equity and thinking about mental health. I guess, do you have any reflections on newcomers and how best to collaboratively approach mental health with that equity mindset?
Sure. So something that I learned today also when I heard about the mental health toolkit from Vancouver Lab. Since we talked about this project that focuses on newcomer youth mental health, it also so what they emphasized was if the mental health issues in the youth age is not tackled at that age, it can translate to mental health issues in adulthood as well. So this is a very timely intervention, and 16 to 14 years is another age when children are going through that turmoil of being transitioning from an adolescent to an adult. So there are complex issues that needs to be tackled, and those interventions are quite important. And apart from that, what I also heard today that was quite interesting was, having resources, especially digital resources, is not the only solution. So when somebody is just referred in terms of, okay, these are the digital resources, and that doesn't ensure any mental health. That personal connection with the service provider, and I also learned another word was the empathy ping. When that connection should come when you are talking to your service provider. And yes, that is where that cultural aspect comes into being. And another story that I want to share from today's session that I attended was this is from one of the Toronto Libs that they added about culturally appropriate services. So they had this session with recently immigrated Afghan women where they talked about mental health, which was given by a English speaking moderator and then translated into their language, but the translation was not in a way that relates to them. So then they all got together, and then they collaborated with faith-based organization, and then the religious aspect was brought into those mindfulness activities. So just sharing some example, when during those mindfulness activities they were said, okay, breathe in, breathe out. That did connect. So they said that when it was related to having that message from the Quran, and then following that with the breathing exercise, that helped more. So another aspect with culturally appropriate is to bring in that religion, because newcomers, those faith leaders play a very important role in bringing that cultural competency in the services that are provided. So yeah, talking about the newcomer lens. Yeah.
Great. Yeah, I think I'm so glad you brought up faith leaders, because I know in earlier years in Peel, when Baldev was the executive CEO of PCHS, he did co-chair a cross-sectoral collaborative where faith leaders were being taught mental health first aid through breakfast networking. So just knowing that the reach that they have might offer some thoughts as well. Great. Just again, feel free to add any comments in the Q&A box as well if anyone wants to share, and happy to hear any further thoughts. I'm going to put in the chat box. There was a booth at the in-person conference here from Wellness Together Canada. So I'm just going to paste it in here. There's their website. And they have free access to counseling where they can, I guess, it's absolutely free and anyone can access it. Behind the scenes, there's a couple of organizations. Kids Help Phone is one. So I will just, since not everyone can see the chat box, I can also just read it out. So it's www.wellnesstogether.ca. And at that website, you'll see some of the resources available, including some education resources. And thinking about counseling, they do offer, I believe, up to 6 sessions. Definitely that first one will help, I guess, support that connection. And if there is a need to continue connecting with that same counselor, that is a possibility. And they can also help with some system navigation. So Kids Help Phone is behind that initiative, as well as Homewood Health, I believe, and one other organization that helps with a bit of the connectivity for that initiative. It's Canada-wide. So that's something that is available across jurisdictions that folks might want to take advantage of. And I know that they're open also to doing workshops as well, if you're connected to service providers who may want to learn more. Great. And I guess, Shri, I don't know if you want to share a little bit about some of the research done by Dr. Naeem from the Center for Addictions and Mental Health, and through the Mental Health Commission of Canada. There has been some resources that are specific to the South Asian community. Do you want to just maybe share a little bit on that?
So yeah, we have him as a panelist at our upcoming forum, and he has done a lot of research about culturally appropriate CBT training for the staff. I've not read the report in depth, but yeah, looking forward to learn more from him during the panel discussion that we have on Monday with him.
Great. Anything else, Kanalpreet, that you've come across as like potential topics that people are interested around mental health?
Sure, Jessica. I just wanted to quickly talk about the point, a very interesting point that you recently brought up regarding bringing in faith leaders sort of to collaborate, with other organizations and service providers, and also Baldevji doing that, like, since a long time. It's interesting because for example, the culture that I come from, sometimes mental health is, mental health concerns or mental health issues are looked at as stigma. So nobody really openly talks about it. And especially when you move to a new country, it's everything appears alien and nobody knows where to go. So when faith leaders can be included and incorporated in that process of awareness, of creating and generating awareness around mental health issues so that people can talk, people can get the required and appropriate services, it's a great channel. It's a great things become easier, the information flows very easily. So if faith-based leaders come in, it can help us to have a wider reach with more people, be it youth, be it adolescents, be it newcomer adults. So that's a very interesting point. And from back home, like all those people who were not really open to receiving services from mental health organizations, when they were told by the faith leaders, they would still be accepting, they would still be open. So over here we can practice the same thing, bringing those people in and having a wider reach, so to speak. So that's very interesting, and I might focus more on that at that point moving forward.
Mm-hmm.
Yeah, and also to add on what Kamalpreet said, that about the stigma, the very terminology mental health is it's not very welcoming. So I learned, so that session that I attended today, there was a program which was named Healthy Mind, Healthy Life. So this is something where they had these wellness sessions for people, which is more welcoming to people who have who come from a different background where mental health is not very positively taken. So yeah, working around those language and terminologies is also a way to reach many people.
That's wonderful. I wonder if each of you has a reflection on how, like, it's hard to navigate the mental health system even as an established resident in Canada. And I guess, knowing that not everyone has mental health challenges that leads to a diagnosis, what role do you think that different community actors could play? So it might be residents, it might be, as you mentioned, Kanalpreet, the faith leaders. Are there, I guess, natural supports that could be shored up with some lip, connections and linkages that we're so good at doing. So I don't know if anyone has some initial ideas. Kanwalpreet?
That's a great point, Jessica. And we're constantly learning and evolving. And as you mentioned, actually, that faith leaders could play a very vital role and very crucial role in, spreading more awareness in regard to the mental health services. Also, like we can other informal channels could be explored as well. So for example, I'll just give an example of my neighbor who had come to Canada last year, and I asked her that, and I live right behind PCHS, like just like 2 minutes walking distance, and I asked her, do you know about our organization? She said no. So I that just completely shocked me, because she lives right behind PCHS, and she had no awareness. So I told her, okay, like, how have you been navigating this whole experience? How has it been going for you? So she said, I came to, one of my relatives, and I found it very hard to sort of, integrate and acclimatize myself to the weather and everything around. So I was like, okay, who was your go-to support person? So she said, my cousin sister who lives, right down the block. I was in her basement for some time, and then I moved out. So that really surprised me as to how these informal channels of communication and support are so heavily relied upon by newcomers. And sometimes, agencies even in the vicinity are unaware about the newcomers. So sometimes that can happen. Some newcomers don't go to agencies at all. When I was a newcomer, I had no idea about, these settlement services. And, I just took support from my friends or relatives who were already living here. So I believe informal channels of support, it could be, there are also, on a side note, we have this neighborhood group that gets, together in the park. So these places could be explored, community parks, community halls, any community spaces or organizations. These could also be brought on board, so that better services and the better inflow of services could be made sure.
Wonderful. Thanks so much for all those ideas. Melanie, do you have any initial thoughts?
So many. I was actually going back to an old presentation. There was a beautiful story early in COVID. I think he was a member of the Sikh community in Ontario. And instead of struggling quietly, he formed a group of friends, and they supported each other. And it was a write-up in, I believe, CBC, and it was wonderful. And it spoke to how groups and peer mentors and support groups can help, and how we can help each other. So whether it's a faith-based leader, I've seen that in particular in our Buddhist community, and then that culturally informed mental health care around mindfulness, and leaders from within the Buddhist community. Also seeing some leaders in cultural communities who were previously physicians, who have all this talent and were willing to give that talent for the people in their cultural community. And they really understood how as a doctor, they understood the health of it. They understood that people don't know the symptoms. They know that people are experiencing the shame of it. But as a doctor, it's very normal and accepted to them. And so they wanted to share that knowledge with their community. So I wish we had more cultural leaders like that. They could, and that we can work with them and really leverage their talents, because I think we're all busy in settlement associations. So how do we leverage that talent and work with it so that the full extent of it can be used? Because I still think we didn't quite tap the potential there. My opening slide had a picture of one of them that's a physician from the Vietnamese community, and she was just instrumental. So that's one area. I was also thinking, sorry to kind of change direction, but it was something that's on my mind. And as you were talking, and you mentioned as well, the healthcare system, our poor healthcare system is struggling, and our mental health system is, and we've got some incredible people trying to make changes and do what they can. But in absence of those changes, or in time, during this time of change, within the settlement association and community groups, we really need to provide education to let people know they're okay, to talk about culture shock, to provide the practical supports, to provide the workshops, the information, everything that Hong Fook recommended. But when you open mental health support within a settlement association and you don't have a system that's able to entirely meet the needs, the mental health needs and the healthcare needs, you end up getting overwhelmed, you know, with the challenges at levels that we're not equipped for. So that's the area that now, where do you balance that piece? So we can provide this critical preventative support and help to people without getting overwhelmed in the one-on-one more crisis needs.
No, that's a great reflection. Thank you for bringing that to light as you move forward in considering the role of the Settlement Association in mental health. Shreya, any other thoughts from your end in terms of community supports for mental health that could be potentially tapped?
Yeah, I would say like for newcomers, and as Kanwalpreet mentioned, those social circles, you know, where newcomers come in contact initially and leverage them as the, like, those social circles are very important means of directing them to other community services. So yeah, those are the places. Yeah.
For sure, and definitely a route for positive mental health. Well, we'll leave it there. And thank you so much, everyone, for joining. And I know we're heading into winter when time is maybe lonelier. So hopefully that we can expand our thinking to include some of those social circles and things that can help through that lonely period. So thanks everyone for joining in, and thank you to each of the speakers, Kanwalpreet, Melanie, and Shreya.